I received a phone call right at the beginning of this pandemic from a hospital administrator, and he had a real challenge on his hand. He had tested a homeless person in his ER for COVID-19. At this point, test results were coming back rather slowly, as much as a week could pass. Couldn't afford to keep him in the ER during this time, and couldn't also release him to the community without a place to self-quarantine. His call to us came as a cry for help. What do? We pulled together and convened a group of key leaders in our community that worked with this population on a regular basis. And in just a few days, came up with a solution: a temporary homeless shelter that could house medically fragile, vulnerable population of individuals that were testing positive for COVID-19 or waiting test results. This came together in only 7 days. This is just one example of extraordinary collaboration that we've seen across our community during this crisis. The homeless population, though, isn't the only demographic that's been hit hard in the wake of this pandemic. Families with children, seniors, and workers are greatly affected by this crisis. Families were left without school or childcare. Seniors had their health put at risk and had to endure strict social isolation. And essential workers living paycheck to paycheck had no choice but to put themselves at risk to go to work and keep our community running. Even with these essential workers on the front lines, millions of folks that live paycheck to paycheck lost their jobs and the income they so desperately needed. These individuals had no savings to fall back on and had no idea how to pay their bills without their income. They are the first to suffer financially from this pandemic, and they will be the last to recover. It will take these folks much longer to recover from their financial stability after the debt they fall into during this crisis. These are the folks that the nonprofit community has been surrounding and uplifting during this difficult time. These are the needs that agencies have been working around the clock to meet and fulfill. On March 17th, before our community and the economy closed, United Way of Greater Knoxville created a COVID-19 response fund and committed $50,000 in emergency funding to beginning helping our neighbors as soon as possible. We mobilized donors, connected with local businesses, and spread the word. So far, we've raised over $1 million and have granted out over $400,000 to take care of the people in our community. We have worked with city and county governments to coordinate a unified response. We have led the social service sector in meeting those needs we discussed earlier, providing child care for families and essential workers, helping fund health services for seniors, for our homeless populations, serving folks that live paycheck to paycheck and have found themselves without any income at all and risk becoming homeless themselves. Though the nonprofit community itself has taken a big hit as a result of this pandemic, East Tennessee agencies themselves reported $12 million in lost revenue and donations since the pandemic began. They have still been working overtime to expand services and meet the community's growing needs in the wake of COVID-19. In the same way that the government, nonprofit sector, and the for-profit sector joined together to provide immediate resources for our homeless neighbors that have been tested for COVID, the major players in our community have been joining forces, working together to solve countless problems and meet countless needs for individuals in our community since this crisis began. And this collaboration and teamwork will continue through the long recovery our community faces. When someone calls for help, we will answer. When there's a problem, we will work together to find a solution. So many things have changed over the past few months, but one thing that will never change is the nonprofit community's dedication to serving those that need it the most. Thank you.